back to gum disease.
Yeah, you said early gum disease.
Yeah.
Is
yeah.
that...
Mm.
Does that mean everyone gets gum disease
No,
eventually? Or?
No. So look, I'll put it very, very basically. It's not, you know, yeah. I'll try and so when you have plaque sitting around your gum line, like I said, your gums get red and inflamed. Okay, that's called, you would have heard it before, gingivitis. So itis is just inflammation. You hear itis everywhere, and then but gums are actually called, it's called gingivitis. So it's gingivitis anyway. So that's bleeding gums effectively. Okay, that is, we can change that. You don't always have to have gingivitis. So good, like careful cleaning can reduce the bleeding of your gums and reduce the inflammation, and then it goes back to normal. So there's been no permanent damage there. When you have long-standing, chronically angry red gums and lots of inflammation in your gums over a long period of time, the gums is just, they actually cause a lot of inflammation around the tooth, and it actually causes some damage to the bone that is looking after the tooth. Okay, so it might be a wee bit easier to explain. I think I've got a picture here. Okay, so this is a healthy tooth, okay, with bone that holds in the tooth, and then the gum sits over top of it. Okay, when you have a wee bit of inflammation in your gums, or it's a bit red and angry, you can clean that off. Keep cleaning regularly, and then the inflammation will go down. Okay, when you have sort of long-standing inflammation, if this is all red and angry all the time, the gum, then it erodes the bone that's looking after your tooth. So as the bone starts to move down, you've got less and less holding on to the tooth, therefore it gets wobbly. Yeah. So if you kind of think like if this is a tooth, like a tree, I guess it's really, if you don't have long, deep roots in the ground, it will easily get blown over by the wind. Yeah. If you have good support from your bone and your gums of a tooth, then it's firm. As that starts to go down, then it doesn't have as much holding it in, so they get a wee bit more wobbly. Yeah, that's gum disease. Yeah. So gingivitis is inflammation, and then you have gum disease, or wordy, periodontitis, but that's the progression from gingivitis, where it's chronic and it's actually caused long-term damage that you can't repair. Yeah.
So how young can you be in getting gum disease?
Young, very young actually.
Very young?
Yeah.
So kids could...
that's a good question. So probably more around, it would start more around adolescence, so in teens, but this is long-term poor oral hygiene that would then cause that damage. That damage that I showed you on the picture is over many years, so kids won't often show the same destruction because they haven't had that gum inflammation for as long. So the reason it's not really found in children is because they have their baby teeth, or young children have their baby teeth, and then they will lose them, and then they're always transitioning to and so it's more when you have a stable adult dentition that then you might start to sort of potentially go down that process, but that's years of damage. So that's why maintaining good oral hygiene practices early, you can avoid these things. I know it sounds weird, but same with decay. It's so sad because it's preventable, and Pacific kids have such high decay rates, and they're overrepresented in the group that we end up seeing, taking to have hospital admissions for their teeth. It's this is not going to fix everyone, but it'll make a huge dent in things, because the wait lists are a year, almost. Yeah, it's really sad. Sorry, with if they need a general anaesthetic, like surgery, yeah.
Mm.
But yeah, I'm making it sound very grim. Sorry, but but positive thing here. I think the main thing is that there is so many small preventative changes that could actually make such a huge difference down the other end. And rather than going, oh yeah, focus on treatment and filling or extractions, it would be great if we don't actually get down there. You know what I mean? Yeah. And I was thinking another thing is that lots of people, like baby teeth do actually matter as well, because people are, oh, it's alright, it's just their baby tooth, and they're going to get another one. They definitely matter. Obviously, they're hard kids. We don't want them to be in pain. We don't want infections, and it affects the quality of life and the whole family, really. If the kid's sick and can't go to school or has a swollen face, then parents can't go to work, and it's just a bit of a snowball effect. So yes, they do matter. When they have to take them out early, baby teeth, then you get complications when the adult teeth move down. There's not enough space, and it's just focus on prevention would be where I'd be putting all my money.